Okay, we're going to continue with understanding Original Medicare Parts A and B. Now I'm going to review the coverage. So let's take a deep breath, sharpen our pencils, get ready to take some notes because now things start to get complicated. First of all, what is Part A? Part A is coverage for a hospital stay. I like to refer to this as the room and board. So Part A covers the room and board. However, it's important to understand some terminology within Part A. The first of which is a benefit period. I'm going to explain that in more detail later, but the reason I bring it up now is because the benefit period of Part A carries with it a deductible. A deductible is what you pay first before the insurance company starts to pay anything. So per benefit period in 2020, Part A carries a $1,408 deductible, $1,408. So for every benefit period that you will have that deductible apply. That's for days 1 to 60 of the benefit period. If you find yourself in the hospital for greater than 60 consecutive days, then you no longer have a deductible, but things change. You now have a per day charge. So from day 61 to 90, you are going to be responsible for $352 for every day that you're in the hospital under Original Medicare. If you had something really serious happen and you find yourself in the hospital for 90 days or greater, then that amount of per day payment goes up that you're responsible for to $704 per day. And that's only for 60 days. Medicare calls these lifetime days. You only have 60 lifetime days during your lifetime to take advantage of. So it's very complex and very complicated, but that's how it works. That pays for all of the charges during the stay from the hospital or skilled nursing facility. If you find yourself in a skilled nursing facility, the rules are a little different. But first, let me explain what is typical in a skilled nursing facility stay here. At times when I do this in person, I get the question of what is a skilled nursing facility stay in this case. Many people think it's a nursing home stay, and it's not that. The majority of the time, it's a rehabilitation stay. So for example, my mother fell down, she broke her shoulder, she went to the hospital, she had to get her shoulder repaired. And then once they made her well enough at the hospital that they felt they could discharge her, she still wasn't well enough to come home yet. So they sent her to a skilled nursing facility for rehabilitation of her shoulder, where she did the necessary exercises and physical therapy and such to get herself ultimately well enough that she could leave there and go home. If you find yourself going to a skilled nursing facility under Original Medicare, days 1 through 20 of, again, the benefit period are at zero copay for you under Original Medicare. However, if you're there beyond 21 days, up to 100 days of that same benefit period, you now will experience a copay of $176 per day at that skilled nursing facility. So that's how Part A works and what it covers. Part B, I like to just generally say everything else. So when you go to the doctor's office, your primary care physician, a specialist, you have tests done, you have blood drawn, etc. All of that falls under Part B. Under Part B, you also have a deductible. And here's an important distinction to make. The deductible under Part B is an annual deductible. So it's per calendar year, January 1st through December 31st. It's not stated as a benefit period deductible. So when it comes to Part B, you will pay the first $198 of coverage, and then Part B will cover after that. However, and I'm leading up to what I feel is probably one of the most important, if not the most important bullet points in the entire brochure and part of this video series. Medicare Part B will start to cover you. However, it's an 80-20 relationship. 80% Medicare will pay, 20% will fall down to you as the Medicare beneficiary. So let's think back to the prior video when I said, hypothetically, you find yourself in an accident and you ring up $1 million bill. If you're on original Medicare, it's likely 20% of that, or $200,000, is going to be your responsibility, and unless you make plans to take care of it otherwise. Medicare, original Medicare, does not have an out-of-pocket maximum level of protection in any given calendar year. So you could have that accident that I just described that rings the register for $200,000, and then 2 months later you could have another accident that could keep building and building and building this level of financial responsibility that you will have. So it's important for you to evaluate your options with that in mind. Some other things to keep in mind with original Medicare. With original Medicare, you tend to have great access to coverage throughout the United States, as you can show any provider your red, white, and blue Medicare card as long as they accept Medicare patients, and you will receive care. There is no network, no HMO or PPO to deal with. In essence, the Medicare system is your network. Medicare also provides a lot of preventative coverage, such as an annual wellness exam and preventative screenings, for example, for cancer. There are some big lapses, though, in original Medicare. What it does not cover, it does not provide coverage for any dental or vision for most folks. It does not cover foreign travel. It does not provide any extra benefits, such as gym memberships, over-the-counter benefits, dental, vision, hearing, among others. So it's important for you to keep in mind what it does provide, what it doesn't provide, and how that financial structure that I just reviewed could impact you. I want to elaborate a couple of points that I mentioned earlier, because these are very important for you to keep in mind. And you should be aware of them, and you should make your loved ones aware of them in case they have to be interviewing the medical professional at any given point in time. Earlier I mentioned that if you are in a skilled nursing facility, days 1 to 20 are covered by Medicare and are a zero copay for you. However, that comes with a caveat. Medicare will only cover those first 20 days if you had a 3-day minimum inpatient hospital stay preceding that. So you have to be in the hospital for 3 days as an inpatient before being discharged to a skilled nursing facility before they will pay. Knowing if you're an inpatient or not is very important as well. Just because you're in an emergency room on a bed does not mean you are an inpatient. Just because the clock went beyond 12 midnight and went into another day does not mean you're an inpatient. In order to be an inpatient, you have to be formally admitted by the attending physician at the hospital to be considered an inpatient. It's important for you to understand that, and your loved ones to understand that, so you know if you're getting discharged, whether you meet the requirements of being covered at a skilled nursing facility or not. Let's go into that benefit period in a little more detail. A benefit period begins the day you're admitted into the hospital or skilled nursing facility as an inpatient. The benefit period ends when you haven't received care for 60 days in a row. So if you go into a skilled nursing facility or hospital after being just discharged within 60 days, you will be within the same benefit period. If 60 days elapse and you get readmitted, then a new benefit period starts. Now, why is that important? Remember, the deductible of $1,408 is tied to the benefit period distinction, not the calendar distinction. So therefore, it is quite possible for you to have multiple benefit periods in a given year if you have multiple health events occur in a given year. So it's important to understand how benefit periods work, how the deductibles work, and how they may impact you when you're admitted into the hospital with original Medicare as your health coverage.